Asthma is a chronic respiratory disease that affects the airways in your lungs. It is a common condition that affects millions of people worldwide, and it can be managed with proper treatment. The main symptoms of asthma include wheezing, coughing, shortness of breath, and chest tightness. These symptoms can range from mild to severe, and they may occur in response to various triggers, such as exercise, allergens, respiratory infections, cold air, or irritants like smoke. Asthma is caused by a combination of genetic and environmental factors. People with a family history of asthma or allergies are more likely to develop the condition. Additionally, exposure to certain environmental triggers can increase the risk of asthma, such as pollution, dust, and mold. There is no cure for asthma, but it can be effectively managed with proper treatment. Treatment typically includes two types of medication: long-term control medications and quick-relief medications. Long-term control medications, such as inhaled corticosteroids, are taken daily to reduce inflammation in the airways and prevent asthma symptoms. Quick-relief medications, such as bronchodilators, are used to quickly relieve asthma symptoms when they occur. In addition to medication, people with asthma may also benefit from lifestyle changes to manage their symptoms. This can include avoiding triggers that cause asthma attacks, exercising regularly to improve lung function, maintaining a healthy weight, and avoiding smoking. In severe cases, asthma can be life-threatening, and it is important for people with asthma to have an asthma action plan in place to manage their symptoms and know what to do in case of an emergency. An asthma action plan typically includes instructions on how to take medication, when to seek medical attention, and how to manage asthma attacks. It's also important to note that asthma can vary in severity from person to person, and even in the same person at different times. Some people may experience mild asthma symptoms that don't interfere with their daily activities, while others may have severe asthma that requires frequent medical attention. In addition to medication and lifestyle changes, there are other treatments that may be recommended for people with asthma, such as allergy shots, which can help reduce sensitivity to allergens that trigger asthma symptoms. It's also important for people with asthma to be aware of the potential complications associated with the condition. For example, uncontrolled asthma can lead to respiratory infections, difficulty breathing, and even hospitalization. People with asthma may also be at a higher risk of developing other respiratory conditions, such as chronic obstructive pulmonary disease, COPD, or pneumonia. Finally, it's worth noting that there are certain populations that are at a higher risk for developing asthma. For example, asthma is more common in children, women, and people who are overweight or obese. Additionally, certain ethnic and racial groups, such as African Americans and Hispanics, have higher rates of asthma compared to other groups. One of the key aspects of managing asthma is identifying and avoiding triggers that can lead to asthma attacks. Triggers can vary from person to person, but common triggers include allergens such as dust mites, pollen, and pet dander. Irritants such as smoke, air pollution, and strong odors. Respiratory infections, such as the common cold or flu. Exercise, especially in cold or dry air. Emotional stress. Certain medications, such as aspirin or beta blockers. By identifying and avoiding these triggers, people with asthma can reduce their risk of asthma attacks and better manage their symptoms. In addition to avoiding triggers, people with asthma should be proactive in monitoring their symptoms and seeking medical attention when needed. This may include using a peak flow meter to measure lung function, keeping track of symptoms in a diary, and knowing when to seek emergency medical care. It's also important for people with asthma to receive regular medical care, including checkups and lung function tests. This can help ensure that their treatment plan is working effectively and can help identify any potential complications early on. It's worth noting that asthma can have a significant impact on a person's quality of life, including their ability to participate in daily activities and social events. People with asthma may experience anxiety or depression related to their condition and may benefit from support from friends, family, or mental health professionals. For children with asthma, it's important for parents and caregivers to work closely with their healthcare provider to manage their child's symptoms and ensure they can participate in school and other activities. This may involve developing an asthma action plan with the child's school or daycare provider, and educating teachers and staff on how to recognize and respond to asthma symptoms. Finally, research into new treatments and therapies for asthma is ongoing, and there is hope that new breakthroughs may lead to even more effective ways to manage the condition. In the meantime, people with asthma should continue to work closely with their healthcare provider to develop a personalized treatment plan that meets their individual needs and helps them live a healthy, active life. It's important for people with asthma to take an active role in managing their condition and staying informed about new developments in treatment and research. There are also various organizations and support groups available to provide information, resources, and emotional support to people with asthma and their families. Overall, while living with asthma can be challenging, with proper treatment and management, most people with asthma are able to lead healthy, active lives. By working closely with their healthcare provider, avoiding triggers, monitoring symptoms, and staying informed about new developments, people with asthma can continue to thrive and pursue their goals and aspirations. Some additional recommendations that may be helpful for people with asthma. Keep an emergency inhaler with you at all times. Quick relief inhalers, also known as rescue inhalers, can provide fast-acting relief during an asthma attack. It's important for people with asthma to keep an inhaler with them at all times, including when they're traveling or away from home. Be sure to check the expiration date on your inhaler regularly and replace it as needed. Get regular exercise. Exercise can be a trigger for some people with asthma, but regular physical activity is still important for overall health. In fact, studies have shown that regular exercise can improve lung function and reduce the risk of asthma symptoms. Speak with your healthcare provider about the best ways to exercise safely with asthma. This may include warming up and cooling down before and after exercise, using a quick relief inhaler before exercising, and avoiding exercise in extreme temperatures or high pollution areas. Practice good sleep hygiene. Getting enough sleep is important for overall health and can also help reduce the risk of asthma symptoms. Make sure to establish a regular sleep schedule, avoid caffeine and alcohol before bedtime, and create a comfortable sleep environment. This may include using hypoallergenic bedding, keeping the bedroom cool and dark, and minimizing noise and distractions. Use a HEPA air filter. HEPA filters are designed to remove small particles from the air, including allergens and irritants that can trigger asthma symptoms. Consider using a HEPA filter in your home, especially in the bedroom and other areas where you spend a lot of time. Make sure to clean or replace the filter regularly to ensure it remains effective. Consider alternative therapies. While traditional medical treatments such as medication and inhalers are typically the first line of defense for managing asthma, some people may benefit from alternative therapies such as acupuncture, herbal remedies, or breathing techniques. These options can help reduce stress and anxiety, improve breathing, and provide additional support for managing symptoms. It's important to speak with your healthcare provider before trying any alternative therapies, as they may interact with other medications or treatments you're currently using. In conclusion, asthma is a chronic respiratory condition that affects millions of people worldwide. While there is no cure, it can be effectively managed with proper treatment, lifestyle changes, and other therapies. By taking a proactive approach to managing their symptoms and seeking medical care when needed, people with asthma can reduce their risk of complications and lead a healthy, fulfilling life. Tell us about what other topics you would like us to make a video. Subscribe.